Prior to joining SAFM, I actually had a previous career in the medical device field. I worked there for more than 10 years, and I started working in the cath lab, seeing heart disease from the inside. And as I talked with some of my interventional cardiology customers, they would say, well, this person just needs to eat right and exercise, but they're not, and so here we are again. And I was just always really impressed with, like, how can we fix this problem? So I ended up leaving that field and wanted to do something more on the preventive route. And then I learned about what functional medicine was and that I could actually practice it. And so then I started researching programs and ended up, joining SAFM. So the great thing about SAFM is that you really don't have to wait until you graduate to be able to start implementing, and that was one of the things that really attracted me to the program. I could start implementing what I was learning right away, because really those foundational things, we learn about kind of the physiological effects of things like lack of sleep or stress or poor nutrition, and those kinds of fundamental things really can make a big difference in our clients' lives. We just have to be able to really give them targeted examples for their unique situation, and that's something that is really easy to start implementing right away as a student at SAFM. So a client I'm working with right now actually just sent me a message. He's having a lot of successes. So he came to the practice with diverticulitis that had, kind of was on the mend, but he wanted to make sure that he could keep it at bay. And so we worked on, gut health to support him so that he could resolve those issues. But then in the process, we also learned that there was something going on with his thyroid. So then we dug a little bit deeper, actually found out that there was some thyroid antibody activity going on. So we started working on optimizing thyroid function and reducing inflammation. And so then he just told me he lost 5 pounds in the last, since the last time we met. That's a sign that inflammation is going down and so that his body is starting to, get on the healing progress. I've learned so much about different aspects of dysfunction within the body and how they can all relate. I just feel so much more confident being able to come up with a plan that's going to help my clients feel better.